Good morning, everyone. Welcome, and thank you for joining us today. My name is Robert Torres, Secretary at the Pennsylvania Department of Aging. It is my pleasure to be here at the Bristol Township Senior Center with my colleague and friend, Acting Secretary of Health, Allison Beam, Director of the Bucks County Area Agency on Aging, Kathy Bennett, and Director of the Bristol Township Senior Center, Bonnie Worth. You will hear remarks from all of them shortly. I'm also very pleased to be here with all the older adults who have made the decision to come and get their flu and/or their COVID booster shots at this special immunization clinic. Thank you, Bonnie and the Bristol Township Center, for hosting us, and I also want to thank ACME for supporting this event. Senior centers are a trusted hub of activities and support for older adults in their communities, and I am pleased to note that approximately 85% of Pennsylvania senior centers, which were forced to close entirely for over a year during the pandemic, have been able to resume operations. I want to acknowledge our entire network of aging providers, including our area agencies on aging and senior centers, for all the work that they've been doing to support and protect the health, safety, and well-being of older Pennsylvanians throughout this pandemic. The duration and severity of this pandemic has been incredibly challenging for everyone, especially older adults and those who care for and serve them. As we continue to work to make progress in dealing with the impact of COVID, we also need to make sure that we're taking proactive, preventative steps to help combat illnesses that are very dangerous to seniors. Older adults need to prioritize vaccinations for many reasons, particularly since our immune systems don't respond as well as we age, making it important to stay up to date with recommended vaccines, including boosters for extra protection. There are some vaccine-preventable diseases that are particularly prevalent and serious in older adults, such as shingles and the flu. Let's face it, as we age, there are some factors that affect our health status that may be outside of our control. For example, there may be diseases that we are predisposed to because they genetically run in our family. However, there are many risk factors that are within our power to address, like getting the vaccines being offered today to help protect you from serious consequences of an illness that can be prevented or that can help decrease the impact if you are exposed. It is particularly important for older adults with chronic health conditions like diabetes, asthma, or heart disease to stay up to date on their vaccinations and to learn which inoculations are covered by their health care insurance. At the Department of Aging's website, we offer some helpful reference information on standard vaccination older adults are advised to get, such as the COVID-19 vaccine and booster, the annual flu vaccine, the tetanus diphtheria vaccine or tetanus, diphtheria, and pertussis, also known as whooping cough vaccine, which requires a booster every 10 years, by the way, the pneumococcal vaccine to help protect against pneumococcal bacteria, which can cause pneumonia and blood and brain infections like meningitis, and the shingles vaccine to avoid the painful effects of shingles on older adults who, again, are especially susceptible. I want to encourage all older adults to please take advantage of vaccination options available to you in your community, options that include your healthcare provider, pharmacy, or vaccination clinics like this one. It is really important for older adults to get their recommended vaccination, not just to prevent illness, but to protect themselves from dangerous complications that can develop. Flu combined with pneumonia, which is a common acute condition among the aging population, is one of the top 10 causes of death for adults aged 65 and over in the United States. And the older you are, when you get shingles, the more likely you are to have severe side effects like exhaustion and loss of appetite, which can lead to malnutrition and other problems. Any questions that an older adult might have relating to healthcare concerns with vaccines should be brought to the attention of your healthcare provider. Older adults may be able to receive their flu vaccine at a local senior center like the one we're at today, and they can contact their local area agency on aging to find out if any vaccination clinics are being conducted in their area. In closing, we want seniors to be protected during the cold and flu season, which is already upon us, and we want them to be healthy and ready to enjoy the joys of the upcoming holiday season with their family and friends. I hope that every adult, older adult, will give themselves the opportunity to stay healthy by protecting themselves now with all the recommended vaccination. And finally, seniors can also help us by being trusted messengers to their family and friends about the importance of staying up to date on recommended vaccines. Thank you, and it is now my pleasure to introduce Acting Secretary of Health, Allison Beam.
Oh, you're all good. Well, thank you. Thank you. Good morning. What an awesome, awesome event to join you at today. Thank you so much for having us. As Secretary Torres mentioned, I am Allison Beam, Acting Secretary of Health, and truly, we could not be more excited to be able to join you today as you protect yourselves, your families, and your communities as we head into the fall and the winter seasons. As Secretary Torres mentioned, we have officially entered another flu season while battling COVID-19 at the same time. However, we know that there are safe and effective vaccines that can lower your chance of getting certain diseases, especially flu as well as COVID-19. Vaccines work with your body's natural defenses to help you safely develop that immunity to that disease. This lowers your chances of getting certain diseases and also suffering from their complications. The flu vaccine and the COVID-19 vaccine reduce the risk of illness, hospitalization, and death for each of those respective viruses. It is most common that certain populations, like infants, older adults, and people with weakened immune systems, like those undergoing cancer treatment, are especially vulnerable to infectious disease. Pennsylvanians, especially our older residents, are best protected if they receive proper immunizations to keep them as healthy as possible and defend against these potentially deadly viruses. Remember that flu and COVID-19 are caused by two different viruses. You can get both of them at the same time, and the vaccine for one does not protect against the other. So it's important to protect yourself fully by getting vaccinated against COVID-19 and the flu. You don't have to delay getting your flu or COVID-19 vaccine or booster dose. You can get both of those today. Luckily, we are here today at a vaccine clinic offering both the COVID-19 vaccine and the flu vaccine. For the COVID-19 vaccine, they're offering both Pfizer and Moderna products today. The federal government has already approved booster doses of the COVID-19 vaccine population for certain populations. If you're fully vaccinated, you have the opportunity today to get a booster dose of the Pfizer or Moderna vaccine if you are 65 and older, 18 or older and living in long-term care settings, 18 and older with underlying medical conditions, and those who live or work in high-risk settings. If you received the Johnson & Johnson, or sometimes called the Janssen vaccine, 2 months ago or longer, you may also receive a Pfizer or Moderna vaccine today if you are 18 years or older. The Centers for Disease Control and Prevention recommends you do receive the same type of COVID-19 vaccine for the booster dose. However, if it's not available, you can receive the dosage available. If you have questions or concerns, we highly encourage you to talk to your trusted healthcare professional and be able to understand what's best to keep you, your family, and your community safe through this holiday season. At the Department of Health, we believe that when people have good information, they will make good decisions, like getting vaccinated. The department has made access and information about the vaccines a priority. We're working hard with providers to encourage every eligible Pennsylvanian to get vaccinated. We know that getting more people vaccinated is our way out of this pandemic. As we look toward the holiday season, which is quickly approaching, we often look forward to visiting with friends and loved ones. But getting vaccinated here, today, we can look forward to seeing them safely. If you are vaccinated, please encourage your friends and your family to also get vaccinated against COVID-19 and the flu for the greatest gift this holiday season, gathering safely and reducing the risk of contracting both of these contagious viruses. Thank you again for the opportunity to join you today, and thank you to all of you who are taking advantage of these vaccinations offered here today to better help you and your community guard against COVID-19 and the flu. Now it is my privilege to introduce Kathy Bennett, the Bucks County AAA Director. Kathy?
Thank you. Hi, everyone, and it's great to see you. On the behalf of the Bucks County Area Agency on Aging, I want to thank Secretary Torres and Acting Secretary Bean for coming this distance and coming to beautiful Bucks County and particularly to beautiful Bristol Township. It's nice to have you here, so thank you so much. I share everyone's concerns that you have heard so far about our seniors continuing to get the COVID vaccine, getting their booster shots, as well as the flu shots. Bucks County, just so you know, for folks that are wondering where else they could go to get a vaccine, there are 2 sites that are still being offered through the Bucks County Health Department. The one is in Warwick on York Road at the what I keep calling the Old Giant. And then there is also one at the Neshaminy Mall. And both those sites are going to continue to be open and available until the end of December. If you need additional information, you can go to the Bucks County Health Department website, in the Bucks County government website to get that information. If anyone has any difficulty finding a vaccine or getting the vaccine, I would welcome them to call us at the Area Agency on Aging, as well as I know the Bucks County Health Department would also welcome phone calls to get more information or to find somewhere to get the vaccine. I do want to take a minute to say a huge thank you to Bonnie Worth, who is, I will introduce in a minute, who is the manager of the Bristol Township Senior Center, as well as to her staff and volunteers. It takes a village to raise children, and it takes a big tribe to run a vaccine event like this. And so we're really fortunate to have so many people that have volunteered to help out. I also want to thank ACME for them coming and doing this for the Senior Center. Senior centers, as you've heard, do so much more than just social events, although I am not downplaying social events, they're very important. But they also help with nutritional needs as well as health and wellness programs, and really trying to provide any resource that a senior might need in their community. And it's at the local level, and so they can help and they know what's available in the local area. Bristol Township Senior Center is a shining example. So for those of you who are members on the board, on the staff, you should be very proud of everything that happens here at this senior center. I also want to take 1 second to introduce the Deputy Director at the Bucks County Area Agency on Aging, that is Bill McTighe. He has come as well and can answer any questions about our services and our programs that we offer. So, without any ado, let me introduce you to Bonnie Worth. She is one of my sheroes as the manager of the Bristol Township Senior Center. She has done amazing work, and this Senior Center has done an amazing amount of different programs. So, Miss Bonnie.
Thank you. Good morning, everybody. First, I want to thank everybody that came out and did a very important today, getting your booster shot. Very important, and thank you so much for all coming out. I also want to thank all our volunteers and our staff who work so hard and have worked so hard throughout the pandemic. Not only helping people get shots in the beginning, getting people signed up on the county registry, also running vaccine clinics here and helping us sign people up to go to local pharmacies and all those partners that have helped us. I want to thank ACME for being here today, the government services from the state, and also the Pennsylvania Department of Aging and our local Bucks County Area Agency on Aging for being our partners in making this happen. We also want to thank all of our volunteers that are here today that are working on our Senior Connect program. We really feel that it's very important, especially since COVID-19 hit, that seniors have been isolated. And we have a program that we're placing tablets with them and making sure that they are able to connect to the outside world. So thank you all the volunteers for that. I also want to thank all the veterans that are with us today, and thank also Caring for Friends who's with us, Vince Schiavone. And thank you all for helping out and making sure that our veterans and everybody who's getting vaccinated get a nice sandwich and treat to take home, snack bag to take home. We have had many partners throughout this pandemic, and I just want to say thank you to all of them. Many people have supported us in many ways, offering virtual programs for our seniors to enjoy, offering all different types of services. So we will continue to do that, and we will continue to serve in the best way we know how, and that's direct health services to our seniors. Thank you very much.
Thank you, everyone, for your remarks. At this time, we'd be happy to take any questions.
Secretary, are you seeing a lot of breakthrough cases? Are you seeing a lot of breakthrough cases in older people, and is that concerning to you? Is that why it's important for them to get boosters now?
So we are closely monitoring breakthrough cases, which by way of background for folks, that's once you've gotten vaccinated, there are still folks that are contracting COVID even after they're vaccinated, which first we should be very upfront about. That's expected. As effective as these vaccines are, we know that they are not 100% effective against the infection. However, they still help keep folks out of the hospital and prevent death. And so we continue to update on our website every month the vaccine breakthrough data, which shows both cases, hospitalizations, and deaths. And of course, we're monitoring that, which is of concern in our elderly population. So even more of a reason to get a booster shot.
What has the demand for boosters been like so far in the state, as well as the demand for pediatric doses for the 5 to 11 crowd? Is one demand exceeding the other, and is one of more concern to you?
So the demand for both boosters and for our pediatric vaccinations have been extremely steady. So remember, boosters really started in August when our immunocompromised individuals could go get that third shot. And many Pennsylvanians have showed up to continue keeping themselves protected, particularly as we go into the holiday season. For pediatric vaccinations, we also saw a tremendous amount of interest in just the first 6 days of the pediatric vaccinations for 5 to 11-year-olds being available. We had roughly 18,841 children get their first dose. And so that's 2% of the eligible population in the PADOH jurisdiction. And so as we continue to try and make sure that folks know it's available to them and that it's convenient for them, we're also making sure that we continue to have that force field of immunity going into the holiday season for both children and for the elderly.
I know first doses have been accelerating rapidly in the state over the last couple of weeks. I think as of yesterday, it was nearly 95% for partial vaccination rate for adults, according to the CDC. Is that number accurate, and do you know why first doses have increased to the rate that they have recently?
So, one, we want to make sure that to the extent that there's still interest in getting primary vaccinations, we don't take our eye off that mission. There are individuals that we know that felt more comfortable waiting till later in the vaccine availability to get vaccinated. And so, just like today's event, being able to also serve primary vaccinations is important while we continue our booster and our pediatric rollout. We are working with the CDC to make sure that that information about first doses is as updated and current as it can be for Pennsylvania, and we continue to try and rework data with them to make sure that's accurate.
Do you think the 95% number is correct for the adult partial vaccination rate, or are you still checking on that?
We're still working through it.
Be different strengths for the different groups with the teenagers and the smaller children when boosters are available to them?
So right now, we are still working through primary vaccinations being available for those that are under 18. And what we just recently were able to work through was those that were 5 to 11 being able to get their first vaccinations. They are of a lower strength. And so we'll continue to see what data the companies put forward to justify what dosage is correct in those boosters. Happy to turn it over.
Are there any other questions for anyone? Okay, seeing none, then thank you very much for joining us for this event. We appreciate it.